Hi, this is going to be a short video just for a pelvic floor check-in. So during most of the pregnancy yoga sessions, we will do a warm-up normally at the beginning of the class for pelvic floor, just to kind of be able to locate the pelvic floor and understand how to engage it. And then also I really encourage you to use these exercises not just during your practice but throughout your day, just to continue to build the strength. So your pelvic floor are the hammock of muscles that sit in between your legs, and they obviously hold all of our internal organs inside, and most importantly in pregnancy they hold your baby in as well. Now in pregnancy you have a hormone called relaxin in your body, and relaxin comes into the body at around 2 weeks of pregnancy, so it's there from the very beginning. And the relaxin hormone allows your body to start to stretch and grow to accommodate your baby, but then also to allow the muscles to open up and release to birth your baby. And relaxin stays at high levels in the body for 6 weeks after, but also if you are breastfeeding, you still have relaxin in your body whilst you're breastfeeding as well. So we know that obviously the pelvic floor is really important to understand how to work and strengthen for the recovery, and that's where there's a lot of focus, the pelvic floor recovery after giving birth. But actually not everyone is aware how important your pelvic floor is to understand before your delivery and in pregnancy. And actually we all should be doing our pelvic floor even if we haven't had babies, because our pelvic floor gets quite a lot of pressure on it throughout just normal everyday life, whether it's from exercise or kind of other activities. So it's a really good practice to have just daily, and I always say to women that especially once you've had a baby you should never stop doing your pelvic floor. Lots of women will actually find that their pelvic floor after a couple of weeks after the delivery will recover quite well, but actually what we need to do is work our pelvic floor for when we're much older in life, because that's often when women do have problems. So today I just want to kind of help you locate the pelvic floor and then explain what kind of exercises we recommend, and then how the pelvic floor and understanding it will also help your labour, your delivery, your recovery, and also your yoga practice. So first of all, locating the pelvic floor. I find it quite useful if you're struggling to feel it, is to have something what we call positive feedback. So either getting a towel or a pillow or something and maybe rolling it up, and then maybe kneeling over the pelvic floor to be able to really feel it, because you just have a bit of pressure pressing against it and it's easier to feel. You can actually work your pelvic floor in lots of different positions. Some ladies prefer to kind of lean forwards on a chair with your head on a pillow. Some prefer to be sat how I am, cross-legged. Some want to be standing. Whatever works for you, but you can work it in different positions and it will feel slightly different. So when you're sitting kind of in your comfortable position, what I want you to imagine you're doing is sweeping from the back of your pelvic floor to the front. So you have kind of 3 spots of your pelvic floor, and it starts from the anus, and then you have the vagina, and then your urethra. So it's kind of like 3 points, and you imagine that you sweep from the back to the front basically. And there's lots of different ways to kind of imagine what you're doing. Some people really find that visualizations help, so that could be kind of, some people think that you imagine that the muscles are kind of sweeping up and picking up a tissue and relaxing down. Some people like to think of it kind of more just a sweeping motion that you feel. For some people, it's easier to locate when you understand the idea that your pelvic floor works in that if you're really desperate to go to the toilet and there's no toilets around, you'd really squeeze because you don't want to wet yourself. Or if you're in a situation where you really need to break wind but you can't, so you draw up those muscles. We don't encourage you to obviously practice whilst going to the toilet, because this could lead to urine infections. But again, those muscles that kind of would stop you passing urine that you draw up, they're the muscles that we're trying to work, but don't work them whilst you're on the toilet. So just also to reassure, at first you may not be able to really feel the difference between the 3 points, and as you practice more and more you then probably will be able to feel the difference, but you should really feel kind of the muscles drawing upwards. And actually if you're working your pelvic floor, you shouldn't know that someone's working their pelvic floor. I mean, at first, if you're really concentrating, you may pull some faces, but I'm doing my pelvic floor right now, and you can't tell. So there shouldn't be no kind of movement anywhere else. It's all in the muscles down here. When you do, especially if you are kind of in the later stages of pregnancy, some women actually like to hold their baby, because when you're doing it, you may actually feel the baby and the uterus kind of moving, and that would be normal if that happens, because when you're engaging your pelvic floor, you're also engaging your abdominals, so that can sometimes just draw the baby up a little bit as well. So what we talk about is your fast twitch and your slow twitch fibers. So you may have heard of different pelvic floor exercises, and you may have heard of a really good app that we recommend kind of a lot on the NHS, and kind of from my yoga training course and things, we talk about it, and hypnobirthing is an app called Squeezy, and that basically tells you, it reminds you to do your pelvic floor exercises, and it gives you kind of timers and things of how to do them, so that can be really useful. But when we're talking about our fast twitch is when we draw up the pelvic floor and then we release it. So I normally find that this is useful to do when you're using your breath work at the opening of the class. So it would be a inhale, draw up, exhale, relax down. Inhale, draw up the pelvic floor, exhale, down. And as you're doing that, you're sweeping from the back to the front, and then you're relaxing down. Back to the front, and then releasing down. And there's different ways that you can use the breath. Some people actually find it easier to release on the inhale and exhale, draw up your pelvic floor. Release on the inhale, exhale, draw up. And I think it's really good to do a bit of both, just to work them in different ways and to kind of know what feels good for your body. The other side is the slow twitch. Now, the slow twitch is where we draw up the pelvic floor, but we hold it at the top. And this is the one that's a little bit more challenging, because what we're aiming for is 10 seconds of holding it at the top. If you're new to pelvic floor, you probably are not going to be able to do this, and you may not be able to do it in pregnancy. But the more you practice, the more you will be able to get there. And you're aiming for 10 seconds, and then at 10 seconds you release down. But what you must remember to do is during that 10 seconds is to breathe. So it's 10 breaths really. So you're drawing up your pelvic floor on the inhalation, and you're keeping it, you're holding it, but you need to allow your breathing muscles to still breathe. Still remember to inhale and exhale, and try not to hold any tension, because when we're trying to really concentrate, we may hold tension in our face, in our shoulders. Try to really focus on relaxing that upper body. You're keeping it separate, upper body nice and relaxed, breathing muscles working, lower kind of body is engaging that pelvic floor. And when you get to your 10 seconds, you exhale. Maybe you want to exhale through the mouth and just let it all go. Now, it's really important that you do both types of exercise, the slow and the fast twitch. The slow twitch, where we're drawing up and holding it, is actually what we're going to use quite a lot in your pregnancy yoga classes for certain positions when we're trying to work on our balance, because it just engages all of our core as well. So it's really good to use to help, and it's really good to feel the sensation of drawing that up whilst remembering to breathe too. So giving it kind of just having to play around what feels right for you, what works. But the aim actually is to do 3 lots of 10 of the fast twitch, so that would be 30 in the end, in one go, and then 3 lots of holding for 10 seconds, so kind of 30 seconds of holding with 10-second intervals. And you want to do that 3 times a day. So it is quite a lot, but just try to think about all the times where maybe you could do it, if you commute to work on the tube, or if you're kind of in a waiting area, or you're waiting for the kettle to boil, things like this. There's times when we're not doing anything where we could actually use, and engaging and understanding the pelvic floor is really going to help in pregnancy, because it's going to build, as I said, it's going to build your core strength, and also by building these muscles, it takes some weight out of your lower back, and obviously your lower back has a lot of weight from the growing pregnancy, so there's more strain there. And then after the pregnancy, actually for all ladies, obviously we don't recommend that you do any exercising until 6 weeks postnatal, whether you've had a vaginal delivery or a cesarean section, But the pelvic floor is something that all women can do from the very beginning after you've passed the first void. So once you've had your first wee after delivery, we really encourage you to be doing your pelvic floor work. So this is something that you know that you actively can do to help your recovery after your baby is born as well. And we know that building our pelvic floor will really help kind of with recovery of obviously our urinary control. It helps with our core work and kind of lower aches and pains, obviously our sexual function as well. So there's lots of really good benefits, but what I haven't mentioned is the importance of actually knowing where your pelvic floor is for when it comes to the birth of your baby, because especially some people who do certain kind of exercises it kind of before having their baby, we know that the pelvic floor can sometimes be so kind of strong, which is great, but actually you need to be able to know how to let it go and release and open to birth your baby as well. So this will just, doing these exercises will just bring more awareness to the area, and really kind of knowing how to let it go. So in future videos, I'm going to talk a little bit about breathing work and breath that will help in different stages of labour, and that will also be quite linked to your pelvic floor and understanding the release of the pelvic floor. So stay tuned for some more videos on that, but I hope that this has helped.